is Stephen Quigley. The film you are watching was created for the parents of children who are identified as carrying an altered cystic fibrosis gene through newborn screening here in Ireland. The aim of the film is to give parents more information about cystic fibrosis and the newborn screening process in general. To do that, I'm going to be talking to two experts in the area of cystic fibrosis. The first of those is Dr. Barry Lennon. He's a paediatric respiratory consultant here in the regional hospital in Limerick. And he was also a member of the steering group that unrolled cystic fibrosis newborn screening in Ireland. So he's going to be able to tell me a lot of things in general about cystic fibrosis and specifically about the newborn screening system. The second person I'm going to be talking to is Dr. Ilana Ward. She's the genetic counsellor for cystic fibrosis in Ireland. So I'm going to be asking her questions specifically about the genetics of cystic fibrosis. Hi Barry. Firstly, thank you for giving us your time today.
It's no problem.
I might start with asking a general question. Could you describe cystic fibrosis in your own words?
Okay, well, cystic fibrosis is a serious medical condition. It is a genetic condition, which means that you're born with it and you have it your entire life. You never grow out of cystic fibrosis. And as things stand at the moment, there's no cure for cystic fibrosis. It is, I suppose we'd say it's a multi-system disease, which means that it affects multiple different organs. It affects them in different ways. The main organs that are affected are the lungs and the digestive system. In the lungs, we get a buildup of thick, sticky mucus that blocks the lungs and blocks the airways and results in recurrent respiratory tract infections. And ultimately, over time, those repeated infections irreversibly damage the lungs. In the digestive system, the main part that's affected is the pancreas. And as a result, people with cystic fibrosis struggle to digest and absorb their food. And as a consequence, they struggle to gain weight. So as a consequence of both of those principal effects, and primarily the effect on the lungs, cystic fibrosis is a condition that has a reduced life expectancy. So the expected or the average life expectancy for someone with cystic fibrosis in Ireland at the moment is about 35 years.
And why is it that cystic fibrosis seems to be more common in Ireland than in other countries?
Well, we actually don't really know the answer to that. Certainly cystic fibrosis is more common in people from northwestern European descent, so that's where Ireland is. Also, all genetic traits, whether they're positive or negative genetic traits, tend to become more prevalent in isolated populations. So Ireland as an island nation would be an isolated population. I suppose in addition, I mean, Irish families traditionally have had, there's been bigger numbers in Irish families than, we'll say, the average European or North American family. And as a consequence, there are more families with more than one child with CF in Ireland compared to other places. It might be some combination of all of those things, or it might be none of them. The truth is we don't really know why it's more common in Ireland.
I gather that newborn screening was introduced in Ireland in July of 2011 and that it's proved very successful so far. Would you be able to talk us through the newborn screening process for cystic fibrosis?
So the newborn screening for cystic fibrosis was added to the existing blood spot screening test. So every child who's born in Ireland has the blood spot taken between 72 and 120 hours of age. It's a small little spot that's usually taken from the heel. And it goes on a special little card and is sent up then to Temple Street Hospital. There are 5 relatively rare metabolic and endocrine conditions that are tested for traditionally, and as of 2011, cystic fibrosis is the 6th condition. So those samples are analysed in the National Newborn Blood Spot Screening Laboratory in Temple Street. Specifically for cystic fibrosis, what they're analysing is a little protein called the IRT, or the immunoreactive trypsin. And it is high in the neonatal period in people who have cystic fibrosis, in infants who have cystic fibrosis. If that value is high, and we define high as being over the 99th centile for that batch, The blood spot then goes to the second level of testing. So the blood spot then is transferred from Tempest Street across Dublin to Crumlin, where it is analysed there in the National Centre for Medical Genetics. And it's analysed there on a 38 panel a 38 CF mutation genetic panel. And depending on the results of that, well, I suppose there are three ways that you can have three results from that second test. The first is that maybe no mutations are found. And if that's the case, then that particular child's blood spot is deemed to be normal and not at risk of cystic fibrosis. The other two test results that you can have are that you could have one mutation identified or two mutations identified. Either way, a phone call is then made back to the regional cystic fibrosis specialist centre to say that a child has been born in that region and will require further follow-up. And that's the process.
And what is the final sweat test?
So the whole newborn screening program is designed not to diagnose somebody with cystic fibrosis, but to identify infants who are at increased risk of having cystic fibrosis. But to actually make the diagnosis, you need to perform a sweat test. So a sweat test involves getting a small sample of sweat, typically from the forearms of a child. You can also take it from the leg, really any area of exposed skin. It's not a painful test, takes about half an hour, and just induces an area of sweating, and that sweat then is collected. The sweat then is analysed to see what the concentration of salt is in that sample. And specifically what we're measuring is the chloride concentration. If the chloride is high, above a certain threshold, then that is considered diagnostic of cystic fibrosis. If it's low, below a certain threshold, then it's considered to have ruled out cystic fibrosis. There is a little region in the middle which is considered an equivocal result, where you can neither rule out nor confirm cystic fibrosis, and that requires further assessment. Okay. That's rare, that's unusual.
And what does it mean for an infant to be identified as a carrier of cystic fibrosis?
Well, what it means is that they are now considered to be a carrier of CF. Specifically, they are a carrier of a CF mutation or an altered CF gene. That means they're like 1 in 19 of the Irish population. About 1 in 19 people just walking around carry that little abnormal mutation. For that person themselves, it really has no significance. If you're a carrier of a CF mutation, then you're well. You do not have cystic fibrosis, and you're not going to develop cystic fibrosis. So really, it has probably little implications for that person directly themselves.
Does being a carrier of an altered cystic fibrosis gene affect a person's health or their lifespan?
No.
Thanks very much for giving your time today, Barry. Do you have any final points that you'd like to make about cystic fibrosis?
Well, I suppose the one thing I would say is we've spent quite a bit of time talking about cystic fibrosis and how serious a condition it is and all the various different elements of the treatment. But just at the end there, we did talk about the carrier. And it is, I suppose, important just to re-emphasize that point, that if a child is identified as being a carrier of the cystic fibrosis mutation, then that child is well and there are no health implications for that child.
From the interview with Barry, we can conclude that CF is a serious condition which affects the lungs and the digestive system. Being a carrier of an altered CF gene will not make your child ill or require special treatment. Finally, 1 in 19 people in Ireland carries an altered CF gene. Thanks very much for joining us today, Alana. I've heard that cystic fibrosis is a genetic disease. What's the difference between a genetic disease and other types of disease?
Well, CF is a genetic disease because it's caused by mutations in the cystic fibrosis gene. The significance of that is that the mutation is not just in the body cells, but it's also in the reproductive cells. And this means that there's a risk of passing that mutation on from parent to child. And therefore that has implications not just for the person who has the genetic disease, or not just for the person who's been shown to be a carrier of the genetic disease, but also for the wider family, for brothers and sisters and parents and aunts and uncles. and so it actually means that that family, the wider family, have an increased risk of having a child with the genetic condition.
And how is it that cystic fibrosis is passed on?
Okay, well, we know that CF carriers, it doesn't have any health implications for that person themselves because they have the second normal working copy which compensates fully. So we don't feel that there are any health implications for people who are carriers. But the implications are actually reproductive. So this means if two parents are both carriers, then they're at risk of having a child with cystic fibrosis. When we go on to have our own children, we only pass on one copy of the CF gene. For anyone who's a carrier, therefore, they have a 50-50 chance of passing on the mutation. If both parents are carriers, that means that there's a 1 in 4 chance in every pregnancy that both parents would pass on the mutation. If that happens, then the child has no normal copy to compensate, and that child would then go on to develop symptoms of cystic fibrosis. Okay. And we call that recessive inheritance.
And what does it mean to be a carrier of cystic fibrosis?
Being a carrier of CF means that you have one copy of the CF gene which is working normally, but the second copy has actually got a mutation. So we know that we each have 2 copies of the CF gene, one we get from our mum and one we get from our dad. If we're a carrier, that means that one of those copies has got a mutation. And
if an infant is identified as a carrier of cystic fibrosis, what implications does it have for the infant's health?
What we know is that being a carrier of CF is not linked to any health risk. Yeah. So we know that 1 in 19 people in Ireland are actually carriers of a CF mutation. We know that being a carrier means that you've got one normal copy of the CF gene and one copy that has the mutation. Mm-hmm. Having a normal copy is sufficient to compensate for the mutation that's not, the gene that's not working, and therefore there are not believed to be any health problems associated with being a carrier.
So if a child is identified as a carrier of cystic fibrosis, it means that at least one of the parents is a carrier, and both of the parents could be carriers of an altered cystic fibrosis gene?
So what that means for the parents is we know that one of those parents will be a carrier of the CF mutation found in the child. So one of those parents will be a carrier of the CF mutation found in the child. For the other parent, we also offer them genetic testing, not just for the mutation found in the child, but also for the most common mutations, which represent about 93% of mutations found in the CF Irish population. There are 2 possible results that will come back. For the vast majority of families, this shows that the second parent is not a carrier of one of those common mutations. Now, the lab are quite good at picking up those mutations, but they can't give 100% reassurance that there isn't a more rare mutation there that isn't part of that screen.
Is it possible for parents to check if they are carriers of an altered cystic fibrosis gene?
Yes, certainly within the newborn screening programme, any families where the child has been shown to be a carrier are referred on to the National Centre for Medical Genetics for a genetic counselling appointment. So once we get those referrals in from the paediatrician, we would arrange a genetic counselling appointment, and at that stage then the parents are offered genetic testing to see which of them is the carrier of the CF mutation identified in their child.
How can parents avail of genetic testing?
So at the genetic counselling appointment, we would discuss the pros and cons of having testing, and we would organise a blood test. It's a simple blood test. It takes around 6 to 8 weeks to get a result for that testing. And because it's a public service, so in other words, genetic counselling and CF carrier testing, there is no charge involved, so it's a free public service.
What are the benefits of genetic testing for parents?
Okay, well, there are several benefits. One is that it allows us to see which side of the family that mutation has been inherited through. So in other words, it allows us to identify other at-risk family members, whether they be brothers and sisters, parents of the parents, so the grandparents, and also aunts and uncles, who are at an increased risk of having a child with CF. And this means that we can offer carrier testing to those family members.
Thanks very much for joining us today, Alana. Are there any final points that you'd like to make in relation to cystic fibrosis?
Well, I mean, in our experience, the majority of parents who come along to the genetic counselling session do decide to proceed with genetic testing. So we kind of go through that with them, the pros and cons of having the testing. And families seem to benefit from having that knowledge and that information about their risk of having a child with a genetic condition, and also just in having the support to really explore the wider implications for more extended family members and how they might be supported in communicating that to those family members.
Okay, thanks very much for joining us.
From the interview with Alana, we can conclude that the alteration to the CF gene is inherited from a parent. It may be the case that both parents carry an altered CF gene. And so free genetic testing is available for all parents of children identified as carriers of an altered CF gene in Ireland. This brings us to the end of our information film. In this, we've seen interviews with Dr. Barry, who told us about cystic fibrosis newborn screening here in Ireland. He described that being a carrier of cystic fibrosis does not itself cause illness or require treatment. Secondly, we talked to Dr. Alana Ward, who told us about the genetics of cystic fibrosis and described that carrier testing is available for free for the parents of children identified as carriers of cystic fibrosis. If you'd like further information about cystic fibrosis, there are two useful websites. The first of these is the website of the Cystic Fibrosis Association of Ireland, and the second is the website of the Cystic Fibrosis Trust in the United Kingdom. I'd like to thank all of those who contributed to the film for their time in making it. Thank you.